Here is a shocking headline that I want to share with you. Here's a shocking headline. COVID vaccines killed more people than World War I, World War II, and Vietnam combined. That comes from a colleague of my next guest. That comes from Nicholas Hulscher. He's an epidemiologist. He's with the McCullough Foundation. 600,000 people, he says. And I bring that to your attention for an important reason. Dr. Peter McCullough will be with me tonight on a special Spaces event, 9 o'clock Eastern. We're going to talk about all of these things. We're going to talk about that, COVID, bird flu, being healthy, Bobby Kennedy, all of it. So don't miss that tonight. And make sure you join us today. We need 25 new followers on X. Are you one of them? That's Steve Gruber's show. Peter McCullough, the doctor, is here with me, the Chief Scientific Officer at the Wellness Company. Doctor, nice to see you today.
Great to see you.
Really looking forward to this conversation tonight because we'll have a lot more time than we do on this program, and we'll be able to explore some things. Here's where I want to start today. Health and Human Services under Bobby Kennedy announced a new Take Control of Your Health campaign. I mean, this is brilliant, but that's exactly what the Wellness Company has been preaching for years, right?
For sure. People can take care of their health through, health and wellness education, nutraceutical supplements, diet, fitness. There's too much of a reliance on the conventional medical system. Pharmaceuticals now are piling up on people. It's time to have a reset. We need a great reset in health, and that's what Kennedy's proposing.
What's a nutraceutical? What is that?
A nutraceutical is a supplement or a vitamin, but typically in a blend at much higher doses, medicinal grade, actually given intentionally to have a medicinal action, but without taking a prescription drug.
Yeah. Okay. I saw a headline yesterday, probably didn't surprise many people, but I was kind of disappointed. Rite Aid. They're filing bankruptcy again. All of those pharmacies going dark after they ran all the mom and pop pharmacies out of so many neighborhoods across this country. The point being is finding your medications a lot harder than it used to be here in the next few weeks because they're going to be gone. Rite Aid's going to be gone completely. You've talked about having a stockpile of prescription medications in people's homes for years here, Doctor. Obviously, it becomes more pressing now, I would say.
I agree. Two ways at the Wellness Company to defend yourself against prescription drug shortages. One is by having emergency medical kits. The biggest one is the field kit that has the broadest variety of critical drugs needed in the setting of an emergency. And then Wellness Company membership, Steve, at the middle and higher level, there's free prescriptions, and they come through our Pharmacy Mart in Beaumont, Texas, and we have ample supplies. I think people should get memberships, go ahead and get their drugs re-prescribed so we can get through this period of trade negotiations with China.
Yeah, and here's what it looks like for those of you that are on streaming or on television. This is the basic kit. There are several kits. There's travel kits and first aid kits, but the medical emergency kit is the first. And so it's the basic building block of making sure you're taken care of in the case there's an emergency. It could be a hurricane, it could be a tornado, it could be an ice storm, could be an earthquake, it could be just the fact that the power goes out, whatever it might be, or that the Rite Aid disappeared and you've got a problem at home and you've got to get to some medications that are right here in the kit. So check that out. One of the fundamentals, of course, that we're talking about already, taking care of your own health, being proactive. What are some key things individuals, people like me, should be doing to avoid getting sick in the first place so we don't need a kit, we don't need to panic?
Steve, nasal sprays and gargles twice a day. I just got up. I did my nasal spray and gargle. Wellness Company features Immune Mist, which is an iodine-based gargle. Outside Wellness Company, my favorites are Clear and Spry from the company Clear. You could use these and should use these twice a day, every day, because the virus is up in the nose for about 5 days before it goes back to the throat and causes a sore throat. So you have 5 days. You could have actually reduced the viral load, let the mucosal immunity take over. So nasal sprays and gargles, best way to reduce the frequency of colds, flu, RSV, COVID.
You know, I just saw some more fear-mongering on headlines this morning about the bird flu. I'm not terribly concerned about the bird flu, but they let me know there are new vaccines available right now. We can get lined up for flu vaccines for the bird flu. I'm not going to be taking one. But your nasal wash, your gargling, that can prevent against a lot of this illness, can it?
It sure is. It's the first line of defense against bird flu. Wellness Company, we've already outfitted the the farmers free of charge with bird flu kits. So we have it covered. Ever since we did that, bird flu kind of settled down out of the news. Egg prices started to go down. I think the farmers finally stopped culling, this ridiculous killing of healthy chickens. And bird flu was, in many ways, Steve, a war of information in the media, not a real threat to humans.
It doesn't seem to be, but like I said, the fear porn is out there every day. They're trying to ratchet it up. For what reason? I don't know. Maybe they sell a few more newspapers. I want to ask you about one other thing. We got a couple of minutes left here. Ivermectin and mebendazole. Ivermectin is an anti-parasitic. It's very effective. And I've been reading extensively recently, doctor, about parasites in people's bodies. I feel sluggish. I feel tired. I'm fatigued, whatever it might be. And you've gone through everything. You've tried everything. You're doing nutrition. You're drinking your water. You're taking your vitamins. Could it be parasites that are slowing me down?
It could. The CDC in 2014 put out a very extensive piece on the underdiagnosis of parasites. They claim millions of Americans have parasitic diseases and they're underdiagnosed. They have vague symptoms. We know that there are parasites in fish, for instance, salmon, sushi, and uncooked seafood. Basically, you can acquire parasites, or drinking stream water, or traveling. So indeed, patients should see a doctor. There are stool, ova, and parasite tests, which are only partially sensitive. But in the right clinical context, people should consider a parasite cleanse. Wellness company, we have ivermectin mebendazole combination under a doctor's prescription. This can handle the problem and solve what for many patients is an enigma. Why are they chronically sick and nobody can figure it out?
Yeah, and it's the hottest thing going, by the way, at the wellness company from all accounts. Ivermectin, mebendazole. You can get it at twc.health/Gruber. Go to the wellness company, find out more about all the things we've talked about today. twc.health/Gruber. You'll save 10%. And tonight, don't forget, join me and Dr. Peter McCullough. We'll have extensive conversations about COVID, bird flu, Health and Human Services, Bobby Kennedy, and all the things we face medically in this country today. Doctor, thank you. We'll talk a bit later.
See you then.
There you have it. Again, that's a Spaces event. You have to be following on Twitter, X if you prefer, at Steve Gruber Show. I need 25 new followers right now. You want to hear Dr. McCullough tonight? Do that. We'll talk a little bit later. I'll be right back.